currently, the standard of care treatment for patients who have relapsed or refractory FLT3-mutated AML is treatment with a FLT3 inhibitor called Gilteritinib as monotherapy, based on randomized phase 3 data showing that it is superior in terms of survival to salvage therapeutic options that were available at the time. And this data was published in the New England Journal a few years ago. However, the duration of response and survival, even with Gilteritinib, despite being better than salvage therapies at that time, is still quite brief. So our efforts in clinical trials are to try and enhance the efficacy and activity of the options we have for relapsed or refractory FLT3-mutated patients by using combinatorial therapies. So adding potentially targeted anti-leukemic agents to Gilteritinib to see if we can improve outcomes, prolong remissions, and prolong survival of patients in these tough situations. So one such agent is Iadademstat. It is an LSD1 inhibitor. So LSD1 stands for lysine-specific demethylase. And it mainly impacts the epigenetic functioning of malignant myeloid precursors and rendering them more susceptible to cell death and differentiation into normal cells. Recent studies in combination with other standard agents have shown promise. And our effort was to specifically look at this agent in combination with the FLT3 inhibitor Gilteritinib to see if in this patient population as well, it will again reveal promise. And currently we're in the dose finding portion of this combination of Gilteritinib and Iadademstat in the so-called FRIDA study. And our efforts to find the appropriate dose continue. We have looked at multiple dose levels. We have found the combination to be quite active. There have been several patients who've had decreases in leukemic cells and many with marrow responses. One of the challenges has been hematopoietic recovery, mainly platelet recovery. So we have dose-reduced Iadademstat in an effort to establish both activity as well as try and optimize hematopoietic recovery for these patients who may be susceptible to bleeding or infectious complications as a result of prolonged cytopenias. Those efforts continue, and our hope is to find the optimal combination dose and schedule, and then expand further to help get a better sense of the activity of the combination. So that's the data that we presented at EHA.